Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Globally, innovations in information communication technology are being used to provide alternative and low-cost solutions to various challenges for populations across the different socio-economic strata. Rachel Champeire and Sulaina Mbabazi are now using their school theory and experience to help young people lead better lives by providing information on sexuality through their Senga app.
I'm a population scientist by profession, specialized in reproductive health and demography. Most times when we are giving out information in sexual reproductive health, we do it in a group or mammoth way, whereby you tell a group of students, maybe in a school, you people, you need to protect yourselves when you need to have protected sex, but you've not moved to the individual who needs this information to give you her side of the story. So we created this app so that this individual would read that information that we give in the crowd, then also be able to ask questions individually without revealing their identity.
Sexuality education is a matter of contest here in Uganda, with some claiming it is against our cultural values and norms and therefore should not be taught in schools or to young people, whereas others think ignoring it is only burying our heads in the sand.
These parents, most especially, don't want to talk about sexuality, reproductive issues. In that you find out a girl has her periods and she's not informed.
Champeire explains why they opted for the name Senga.
First of all, it's Ugandan. You can really feel this is a Ugandan thing, it's catchy. And when you talk Senga, you have to link it somehow, somewhere, someone has an idea of. There's something sexually related.
We want to change the perspective people have towards the word Senga.
However, the importance of sexuality education cannot be underestimated due to the fact that the side effects, like teenage and unwanted pregnancies, are so costly. It is estimated that unintended pregnancies and their side effects cost Uganda nearly $14 million, approximately 51 billion shillings annually.
The danger of letting children explore on their own is that they usually end up in the negative side. Maybe she gets pregnant. When she goes to the hospital, she realizes she should have used maybe protection.
They can even share this information on their social media platforms. It's not that you have to only share pictures and I was here today, I was eating this, but you can share that good information that everyone will earn from.
This application is downloadable to your Android mobile phone for now. The team explains how it works.
It looks like this, has a blue feature with two smiles of the people. Then you open, select country, there is Uganda, Kenya, Rwanda, Tanzania. It's right now in Uganda. Then select your age group. There is below 18, 18 to 24, 25 to 30, and 30 years and above. So you have 18, either you choose any you want. Then the gender, female or male. Then did you ever receive sex education? You either give yes or no, or I don't remember. Then the responsibility, are you a student, are you a parent, are you a concerned adult? You choose the topics you're interested in. You can choose contraceptives, I can choose cross-generational, I can choose drug abuse. So you put in your name, your email. We give them tips every day. So we have the tips. Then we have the stories. You can read through the stories. And then we have health centers. We connect you to the health centers. We so far have Reproductive Health Uganda.
We were also interested in finding out how they deal with the issue of protecting the identity of the users.
You ask a question, but the name won't be seen to just be a question. However, on your app, on your phone, you'll be able to see your questions where they have been answered.
The team works with qualified experts in the medical profession for clarity and provision of correct information.
And about the age appropriateness, we use this sexuality education framework that was released by the Ministry of Education in 2018 to guide us on the age appropriateness and which information to put out.
The team says the application has been running for 2 months now, but they have been developing it since 2016, and here is why.
They are financially not well, and we would want to have some other way of providing this information to these people. We would like maybe to give them messages maybe if they can get a way of talking to us, we would want to do some community outreaches, go to those rural areas because people don't have phones.
We welcome that innovation because we are in an era of innovations and technology.
The World Health Organization says health innovation responds to unmet public health needs by creating new ways of thinking and working with a focus on the needs of vulnerable populations. WHO engages in health innovation to achieve universal health coverage within the context of the Sustainable Development Goals. Innovation and technology have the power to do many things, and changing the world is just one of them. We are privileged to live in a time where information technology and innovations are helping us live our lives easier. By just a click on your mobile phone, you can now access information on sexuality education through the SengaApp, a topic not comfortably discussed by many. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities.